Shire is a specialty biopharmaceutical company where responsibility is about how it approaches its business. Shire believes it has a responsibility to the patients that need its treatments to provide those treatments, but also to create an understanding of the conditions themselves, as many of them are rare or misunderstood. Taken together, this approach allows it to fulfill its purpose of enabling patients with life-altering conditions to lead better lives. This is Liam. He is a professional kayaker, filmmaker, sport coach and ex-secondary maths teacher. He also suffers from ADHD, or Attention Deficit Hyperactivity Disorder. ADHD is a behavioural disorder with symptoms that include inattentiveness, hyperactivity and impulsiveness. It is the most common behavioural disorder in the UK, affecting between 3 and 9% of school-aged children and young people, but remains widely misunderstood. Diagnosis of the condition is also very difficult to confirm, leaving many patients without appropriate treatment.
I got diagnosed with ADHD at the age of 8. I went to the doctors and it took about 3 to 4 months to get my first diagnosis of ADHD.
But for many, it is a longer road, and getting accurate information is crucial. Fintan O'Regan is a behaviour management consultant who understands how important it is to educate doctors, as well as teachers and family members on the symptoms of ADHD.
Diagnosis can take anywhere from 3 months to 2 years. One of the reasons ADHD is so difficult to diagnose is that it is a spectrum condition. For that reason, there could be many other learning and behavioural issues that also need to be considered in the diagnosis. There's also a range of other features that could mimic the symptoms, and so for that reason, careful diagnosis is absolutely crucial.
With over 20 years of ADHD experience, Shire is committed to raising awareness of ADHD through an education programme, focused on teachers, physicians and others in the community to be able to identify the symptoms and signs of ADHD.
There's a clear need for educating people, providing robust not only clinical data but other educational information to broaden people's understanding.
Dr. Cassie is a child and adolescent psychiatrist and a member of the Adult European ADHD Network. He works at this paediatric hospital here in Nice, France.
Ce qui est toujours frappant dans toute la littérature et même dans la pratique quotidienne auprès des enfants et des adultes atteints de TDAH, c'est que les médecins qui sont consultés régulièrement par ces gens qui sont en demande d'un diagnostic ou d'une aide ne sont pas au courant de l'existence du TDAH.
Shire's education programme seeks to do this in a variety of ways, sponsoring new research and conducting educational work with physicians, policymakers, teachers and others. In 2010, it helped establish the Pan-European ADHD Education Institute to provide a forum for sharing scientific information on the condition with doctors around Europe. And its work doesn't stop there. Amongst other treatments, Shire is also involved in human genetic therapies. In the treatment of such diseases as Gaucher, Shire is committed to addressing the needs of patients.
Gaucher disease is a storage disorder resulting from a deficiency of an enzyme which cannot completely metabolize or digest a complex molecule that ends up building up in particular cell types called the macrophage that are essentially responsible for clearing byproducts of cellular turnover.
The disease is variable, ranging from no outward symptoms to severe disability. Michelle Newman suffers from type 1 Gaucher and was diagnosed not long after her birth.
My symptoms of Gaucher were anemia, an enlarged spleen, enlarged liver, bone crises that would come and go over the course of the Gaucher attacks, and tiredness, general tiredness a lot of the day. If I did not have enzyme replacement therapy, I feel that I would really be in dire straits.
Over 2 years ago, a critical shortage of one of the few commercial medications used to treat Gaucher disease left people like Michelle with inadequate access to treatment.
These are really critical diseases, so if these patients don't get these treatments, they become really sick very, very quickly. they become what we call symptomatic very quickly, and some of these diseases have ultimately fatal implications for the patient. Certainly true of Gaucher. Those conditions deteriorate over time.
At the time, Shire's medication for Gaucher disease was just completing its phase 3 trials. Given the serious illness faced by patients, Shire worked with regulatory agencies to make the product available as soon as possible. First, Shire offered the product through processes that allowed patients to get on a therapy before it was commercially approved, sometimes free of charge. Then hundreds of Shire employees worked tirelessly day and night to file for commercial approval of the product with the appropriate agencies around the world.
Back in 2009, with these acute shortages, we've been saying now for a number of years that the patient is front and centre of everything we do here in Shire. So when you're faced with a situation that patients have a desperate need for product and you may not get paid for a few months for that product, we don't even think about that. The first and right thing to do is to make sure the patients get that product, and we'll worry about payment down the road. And so, for me, it's a big thing about if you say things like the patient's the centre of everything we do, you better mean it.
I would say to Shire that I am extremely grateful that they decided to spend their time and efforts on developing a drug that really treats so very few people in this world. And I think that, as with Shire, there are other diseases that could use a knight in shining armor like Shire has been for Gaucher, and it is a wonderful thing. So thank you.